Access and quality are key pillars in attaining universal health coverage, not only in Kenya, but other countries in the African continent. Now, our reporter Elizabeth Atieno has assessed how the national health insurance schemes in Kenya, Uganda, Ethiopia, and South Africa vary, and filed this report.
On the 1st of October 2024, the government of Kenya launched the Social Health Authority, which has so far registered 25 million Kenyans. The new health scheme was designed to replace and enhance the National Health Insurance Fund, but SHA has been gripped with serious corruption allegations, from payments made to ghost hospitals and allegations of fraudulent claims made by some facilities to defraud SHA. Additionally, there have been cases of technical hitches in the SHA system.
Watch this space. SHA is going to work because we are going to eliminate fraud.
The Social Health Authority houses 3 funds, including the Social Health Insurance Fund, SHIF, which is funded by Kenyans through the 2.75% monthly deductions on their income, whereas the Primary Healthcare Fund and the Emergency Chronic and Critical Illness Fund are funded by the Exchequer. However, the funds under the national government have faced a huge funding deficit. For instance, in the 2025-2026 financial year, the Primary Healthcare Fund was allocated 4.2 billion Kenya shillings against a requirement of 62 billion Kenya shillings, while the Emergency Chronic and Critical Illness Fund was allocated only 2 billion Kenya shillings against a resource requirement of 107 billion Kenya shillings. The adoption of health insurance schemes varies in different countries in the African region. Ethiopia has been implementing the voluntary household-based scheme dubbed the Community-Based Health Insurance (CBHI), which mainly targets the rural and informal sector, whereby households pay annual premiums to access services at then paneled health facilities. The government of Ethiopia also subsidizes the CBHI scheme with premium contributions and waives medical fees for the poorest households. In 2024, the scheme was supplemented by a new and mandatory social health insurance for the formal workforce.
What Ethiopia has done is it covers a minimum of 45% of its population. It is nearly almost 50% with the population we have now, with community-based health insurance system, which covers 63 million of our population recently. And within the next year, we will be implementing also a total social health insurance coverage with a pooled resource of community-based health insurance system, governed and also led by the government. And this is also to ensure that our communities, especially people in need, are not left behind.
In Uganda, the health insurance system lacks a legal framework. Although the 2019 bill was passed in 2021, it is yet to be assented into law by the Ugandan president. Further, the health scheme does not extend the benefits to the entire population.
Availability, accessibility, affordability, and accountability. How we actually make sure that we use the money more efficiently, how we're accountable for the resources we have, we make them more available, and affordability, health insurance being a key approach to that there, which is really welcome.
On the other hand, South Africa operates a mixed healthcare system where the National Health Insurance (NHI) aims to provide universal coverage, while existing private medical aid schemes offer supplementary cover for those who can afford it. The NHI allows registered users to receive services at the point of care without payment. Elizabeth Atieno, TV 47.
All right, thanks, Elizabeth, for that report.